मंच पे आ रही हैं एक बेहद खास शख्स। अब हम सुनेंगे एक कीनोट प्रेजेंटेशन इसी आयुष्मान आरोग्य मंदिर और स्वस्थ भारत के विषय पर आराधना पटनायक से। आराधना पटनायक जी इज जॉइंट सेक्रेटरी मिनिस्ट्री ऑफ हेल्थ एंड फैमिली वेलफेयर गवर्नमेंट ऑफ इंडिया। आराधना पटनायक जी, कुड वी प्लीज हैव यू ऑन स्टेज। आपके कीनोट प्रेजेंटेशन के लिए हम बेहद इच्छुक हैं आपके आज वाणी को सुनने के लिए। तो जोरदार तालियों से आराधना पटनायक जी का स्वागत किया जाए, जॉइंट सेक्रेटरी मिनिस्ट्री ऑफ हेल्थ एंड फैमिली वेलफेयर।
Very good morning to all of you. At the outset, I would like to congratulate my frontline warriors whom we have heard just now, the CHOs and the ASHA workers who have come from all over the country, and you heard their field experiences. I would like to give a background on how this Ayushman Aarogya Mandir, which we call the gatekeepers of health, how it was conceptualized and how it was brought in the health system. The major challenges which we were facing initially, as you all are aware, that if we want overall and sustainable development in the country, we have to focus on health, education and overall well-being of the citizens. So the challenges which were there with the core of the health sector were providing accessible, affordable and quality healthcare to all. And the focus earlier was on selective and fragmented primary healthcare services, while focus was on the maternal health, reproductive and child health, adolescent health. Somehow the chronic diseases which are a major burden in the country were not being addressed at the sub-health centers and PHCs level, and this was leading to an overburdening of the secondary and tertiary healthcare facilities and low utilization of the sub-health centers, which were the first point of contact, and high out-of-pocket expenditure was happening because of the travel expenses and the high cost at the secondary and tertiary healthcare level. So to tackle this, the National Health Policy 2017, this visualized the inception of the Ayushman Bharat Yojana, the program which basically focuses on providing affordable and accessible healthcare, quality healthcare to all, by shifting from selective and segmented care to comprehensive primary health care. And this was launched in the year 2018, the Ayushman Bharat Yojana, for delivering comprehensive primary health care. These Ayushman Aarogya Mandirs are now the first point of contact for us, for the entire society, for rural as well as urban areas, and they provide comprehensive, continued, convergent, coordinated and cost-free care to all the citizens. There are 4 pillars of this Ayushman Bharat Yojana. One which I said is the Ayushman Aarogya Mandir, which is the core for comprehensive primary health care. The second is the Pradhan Mantri Jan Arogya Yojana. You all are aware it is the world's largest health assurance scheme, providing secondary and tertiary care to the citizens. And the Ayushman Bharat Digital Mission, which basically focuses on leveraging the IT for providing access, equity and continuum of care to citizens. And the Pradhan Mantri PM Abhim, that is the Pradhan Mantri Health Infrastructure Mission, which is again one of the largest pan-India infrastructure mission for strengthening the healthcare system. The Ayushman Bharat scheme, it envisages achieving universal health care coverage through the 2 pillars which are at the basic primary level, which we call the gatekeepers, that is the Ayushman Aarogya Mandir, which are the first point of contact, as I've already said. And for secondary and tertiary care, the main program is the Ayushman PMJ, that provides services for secondary and tertiary care. There has been a paradigm shift in the approach of the government from illness to wellness, from selective segmented care to comprehensive primary care, and from fragmented care to continuum of care. And this we are envisaging, this we are trying to ensure through the two pillars which I have already said, the Ayushman Aarogya Mandir at the primary level and the PMJ scheme which focuses on the referral linkages at the secondary and tertiary level. And the continuum of care is ensured through these referral linkages between the primary, the secondary and the tertiary care facilities and their follow-up and referrals. The key reforms which have happened at the Ayushman Aarogya Mandir, this is the main, I think, transformation which has happened at the primary level. The earlier, if you remember, we had the sub-health centers and the primary health centers which were providing basically reproductive, child, maternal, adolescent health care, and simple illnesses were being treated. But major of the chronic diseases, majority of them, we didn't have any facility for treatment. Now, these also have been brought under the ambit of comprehensive primary health care at the Ayushman Aarogya Mandir. So there has been upgradation of infrastructure, additional HR through CHOs, as you have heard the CHOs, they were sharing their experiences, expanded packages of services, free drugs, diagnostics, and a robust IT mechanism along with teleconsultation services. This paradigm shift which I said was from selective to comprehensive primary healthcare, that you can see is through addition of 6 more services. Earlier we had only 6 packages of services focusing on the maternal, child, adolescent health care and simple illnesses and management of communicable diseases. But now the focus has been more on, in addition to these services, these are the core. Apart from them, screening and prevention of non-communicable diseases, oral care, ENT care, palliative care, mental health care, all these, and trauma and emergency care also have been added in the packages. The focus earlier, which was on illness, has now shifted to wellness. So we also conduct yoga sessions, eat right campaigns happening in the Ayushman Aarogya Mandir, meditation, wellness activities, promoting healthy diet. All these are also now a core of these services which are being provided at the Ayushman Aarogya Mandirs. And apart from promotive healthcare, there's preventive healthcare as well as curative, that is diagnosis, treatment, and risk assessment and screening, which is a new component which has been added and has really made these Ayushman Aarogya Mandirs the gatekeepers of primary and comprehensive healthcare. Risk assessment and screening of hypertension, diabetes, and the 3 common cancers at these Ayushman Aarogya Mandirs, and then also upward and downward referrals for continuum of care. As I've already mentioned earlier, we are having fragmented care services. Now this has shifted to continuum of care services. The Ayushman Aarogya Mandirs at the first point of care, and further referrals at the secondary and tertiary level for management of complications. Now at the Ayushman Aarogya Mandir, we have 2 major arms. We can say the left arm and the right arm of the health department are the CHOs and the ASHA workers. So CHOs have been specially placed in these Ayushman Aarogya Mandirs for not only providing clinical role, which earlier was also being provided, but also managerial, public health and leadership roles. And the major additions which I have said is management of screening, risk-based assessment, screening and management of the diseases which were earlier not covered, like NCDs, that is the non-communicable diseases, cancer, etc. And the ASHA workers, they have been a strong force since 12 years. They are basically the facilitators of health services and are the grassroots volunteers who provide the first point of contact. They are basically the linkages between the community and the health facilities that we have, that is the Ayushman Aarogya Mandir. At these Ayushman Aarogya Mandirs, we also provide free medicines. There are a list of essential drug list which is being provided at Sub-Health Center. It is 106, and at the PHC it is 172. Free diagnostics, that is 14 at the Ayushman Aarogya Mandirs and 63 at the health and wellness centers. There's a robust IT system which provides all the required information to the CHO for the community management of all the diseases and also for continuum of care. And teleconsultation services, this also is a new addition in the entire ambit of services which are being provided at Ayushman Aarogya Mandir through the e-Sanjeevani platform. The IT-enabled structure which is there at the Ayushman Aarogya Mandir, these Ayushman Aarogya Mandirs, the CHOs are equipped with laptops or tabs to create electronic health records, which you are aware the Abha IDs are being created there. And also there's online monitoring of the NCD, the Ayushman Aarogya Mandir portal, all the 12 packages, the services which are being provided there, they are all fed online on a day-to-day basis and a real-time basis. To ensure Jan Bhagidari, that is community participation, we have Jan Arogya Samitis at the Ayushman Aarogya Mandir level, where basically to ensure ownership of the health and wellness centers, and more than 1 lakh Jan Arogya Samitis are in place at present. Also there's village health, sanitation and nutrition committees, more than 5.5 lakh such committees are there in place at the village level. And Mahila Arogya Samitis, these are at the urban health and wellness centers, wherein the women from the community, they form a close group and they contribute towards participation and awareness in health and health promotion and disease prevention. I would like to highlight one recent initiative which the Ministry of Health and Family Welfare has taken up. This was launched on 17th September, Ayushman Bhav campaign. This campaign basically focused on reaching out to the last mile and providing all the health services to the doorstep of the citizens, as well as providing specialist services from medical colleges. Doctors, specialists were also engaged and they participated in the health melas and provided specialist services. The major achievement of this Ayushman Bhav campaign is more than 13.5 crore till date is the footfall, and as you can see the figures already there on board, more than 6.5 crore Ayushman cards were distributed during this mela. And more than 18 lakh melas were held, and at the CHC level nearly around 49,000 melas were held, and Ayushman Sabhas were also more than 1 lakh Ayushman Sabhas were organized. Now the achievements of AAM I would like to focus on. If you see the transition, the growth, when we started in 2018, we had only 17,000 Ayushman Aarogya Mandirs. Today we have 1,64,000 Ayushman Aarogya Mandirs, almost more than 8 times increase. And the footfall has increased more than 6 times, from 32 crores to 241 crores. For screening of common NCDs, which again is a new initiative which was earlier not available, these services were not available at the Ayushman Aarogya Mandirs, the health sub-centers. Diabetes screening has increased from 6 crores to 52 crores. Hypertension from 7 crores to 59 crores. Common NCDs, the oral cancer, breast cancer and cervical cancer, you can see the figures. Oral cancer, it has increased from almost 3.6 crores to 34 crores. 1.9 crores breast cancer screening to 15.85 crores, and cervical cancer screening is at present is around 10.64 crores. Apart from this, there are certain other initiatives also taken up by the Ministry of Health and Family Welfare, and through the day there are sessions I was seeing you have, wherein on various activities, programs, you have the sessions. Some of them just I would like to highlight is a recent initiative which is focused on the PVTG population, that is the PM Janman program, providing access and affordable health services to the particularly vulnerable tribal groups, and the Pradhan Mantri National Dialysis Program, PM Dialysis Program, which also has services from Ayushman Aarogya Mandir screening happening till the dialysis services being provided at the district hospital level. Through these interventions, the outcomes which we have, which had envisaged, if you try to compare it with my first slide, which the challenges which I had posed, to the solutions and now the outcomes which we are at present witnessing, improved population coverage, reduced out-of-pocket expenditure, decongestion of secondary and tertiary health facilities, and improved population health outcomes. We have already achieved the SDG goals of MMR and IMR. And the way forward, at the end, I would like to just highlight our focus. The Ministry of Health and Family Welfare is focusing on further strengthening these Ayushman Aarogya Mandirs, because they are actually a first point of contact. They are, at the village level, if you see, people call them as Mera Aspatal. It is the first Aspatal for them. And giving quality care there to all these, through these Ayushman Aarogya Mandirs, strengthening the use of technology, and also taking specialist services, coordinating and collaborating with the medical colleges, and integration of all the packages, 12 packages which we are providing. There are still certain areas, far-flung areas, where we have these challenges of providing all the 12 packages. So the way forward for the ministry is ensuring all these 12 packages are provided at all the Ayushman Aarogya Mandirs, and also increasing the number. At present we are at 1.64. By March we are targeting to reach 1.8 lakh population. So overall, I think this is the gist of, I wanted to give you the background of how this Ayushman Aarogya Mandir was conceptualized and visualized and implemented, and now we are seeing the outcomes of this. Thank you.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.